We also know that the language that we use really matters, and we want to focus on concepts and not necessarily the labels of those. I have another great example of focusing on the concept and not the label. This is my little dog Callie. That is not my big dog Chase. Same color, same coat texture, different animal. That is a cow. And this cow took a interest in my little dog. My little dog took an interest in rolling in the dirt under this cow. And there's a lot of different ways I could have reacted in this situation. Because I needed to urgently get a message across that I needed my dog away from this cow before she got stepped on, I used very simple language, no labels. I said, Callie, come here. What the reasoning that was happening in my mind was, Callie, come here because I'm not about to give you 3 baths in 24 hours or panic over a vet bill because you're playing under the hooves of an animal that weighs, I'm not very good at math, 300 times, 1,000 times more than her. So I described the concept of urgency, Callie, get over here, but I didn't label it. And I think that's important for us to think about, like, where does this come up elsewhere in our lives? Because we are so dependent on the labels and terms of our field that it's very easy to default to that. I'd shared the example earlier of bystander intervention. People outside of sexual and intimate partner violence prevention may understand that label, but they're also more likely to resonate with the actual concept of we look out for each other. We don't let foul language slide. We don't let disparaging language about each other slide. Things like that are more relevant to people than the label and the term itself. So we have one example of social determinants of health. I'm not going to read this long definition. We will be here all day. But we know what this is. We know the institutional definition of it. We know how it applies to our work. It's also our responsibility to create a translation of that that actually relates and resonates to the people that we're working with in prevention, right? Because, like Ashley was talking about with at the start of the COVID-19 pandemic, people were finding ways to support their community. We know that people were working on social determinants of health. We know that when you address one social determinant of health, you're also helping prevent violence. It can be hard to communicate that to people who are not familiar with a very jargony term like social determinants of health, if we're not able to boil it down and distill it down into plain language and what it actually is. I feel like it can be hard to say that in plain language because it is, such a lofty concept and very ingrained in a public health sphere. But those were some examples that we had come up with, that bystander intervention is helping people look out for each other's safety. Community level prevention is changing structures to make communities healthier and safer, or creating safer environments, creating a world slash community we want to spend time in.
Which, Tori, I have to say, what we have here as a plain language description for community level prevention is not, right? Because I know myself, if I didn't know what it was and I saw changing structures to make communities healthier, I would think about like a building structure. Like that's
Yeah,
where my mind goes, right? Like I
yeah,
don't
yeah.
know structure in a different context, just automatically. So.
Right. My sister-in-law's an engineer. If I would have said that to her, she'd be like, "Oh, so like what support beam are you changing?" Like, well, it's more of like a figurative support beam that we're adding, but okay. So again, this is a never-ending learning process, and what makes sense to Ashley and I, we have this opportunity now to read it again and say, "Oh, okay, we missed one there."